All right, I have a question for you
Okay.
since we're discussing the face. I have a friend that really would like to have her nose fixed, but
Okay.
her main concern is she's afraid about having it broken
Okay.
because she hears stories that they break your nose, during surgery. Is that always the fact, or can they do a, rhinoplasty without breaking the nose?
Sure. I would say that the vast majority of rhinoplasties do involve what we refer to as an osteotomy. An osteotomy is breaking the nose or breaking the bone. And an osteotomy, in principle, is something that orthopedic surgeons will do, and to straighten a finger or a toe or whatever, or even a leg. And so that, in principle, isn't such a bad deal. But certainly in the facial area, an osteotomy might be something that a patient might have some fear about. But I'll say this: if the nose is deformed or has a deviation, your best bet at making that deviation less intense frequently will be to do some type of an osteotomy to get it straighter. If that's not the issue, though, I mean, there are some patients that simply purely have a big square, kind of a bulbous sort of a tip to their nose, a boxy looking tip. And for those, there's lots of things you can do. You can divide the dome cartilages and overlap them a little bit. You can do remove some of the fibrofatty tissue from the tip of the nose under the skin there. You can suture the cartilages together a little bit to get the tip to look different. So there are things that you can do that are confined to the tip alone. And there are instances when I don't do when I don't break the nose, but it's not usually because the patient's saying, "Please don't break my nose." I mean, we try to be compliant and respectful of the patient's wishes, but a lot of times they don't really know what they're asking for. So that's why it's handy and it's very fruitful sometimes to go ahead and take some digital images of the patient, put them in a computer, and do a imaging or a morphing or a modification, manipulate the images so that they can see or get an idea of what they would look like with a given change that I would perhaps suggest.
Is that considered part of the consultation, this morphing
Usually,
that you're talking about?
Yeah, that would be part of the consultation.
Right, so they can see what they look like before and after?
Well, yeah, that's what they say, but what I say is this: I'm not promising or guaranteeing that that's what they would look like after, but what I suggest to them is that this is the direction of change that we're going to move towards, and I think that's a reasonable way to describe it.
Right.
Because there's lots of things that can affect how a person's result might differ from what we're predicting it to be. Because a rhinoplasty is a rather precise procedure, and it takes the surgeon skill, but it also takes the patient's capacity to heal, and it also requires that the pieces remain in position, through the healing process, and that they don't distort as the nose heals, because there is a certain amount of shrink wrap type of tightening of the tissues that goes on after the nose has been manipulated, if you will. So, and that's not always predictable. So, and rhinoplasty is one of those procedures, frankly, that not infrequently does require a little touch-up, and it's a challenging procedure. Seeing the nose in the center of your face, and people, feel like the nose has got to really look good. My feeling is that the nose has to be in balance and proportion with the rest of the face. It's the eyes and the mouth that people want to see and connect with.
Right.
So the nose just kind of maintains a balance there.